Welcome back to Great Day. My next guest has served on the White House Healthcare Advisory Committee for 5 years under Presidents George Bush and Bill Clinton. He's an oncologist with 50 years of experience and says that when it comes to defeating cancer, knowledge alone is not enough. Dr. Philip Salem is back with us. All right. You've served in all types of areas dealing with cancer, and you're currently the president of Salem Oncology Center. And knowledge is important. A lot of us, it's out of sight, out of mind, until it comes into our life. All right, so there are so many other things that you say make such a big difference, even outside of the traditional medical care. And one of it is patients need love and compassion.
Sure. You know, this book is a message to the patient and is a message to the doctor who treats him. The message to the patient is to help the patient make the right decisions so he will receive the best treatment that will give him the highest chance for cure.
Yeah.
It is a message to the doctor who treats him, because the doctor needs to remember that there is a human behind the disease. Many times we forget that human. My emphasis is that in cancer therapy, of course, knowledge is very, very important, but it is also important to embrace the patient with love,
yeah, I have
caring.
A friend who had actually the first stem cell done in the country, and he said that every doctor he went to in the beginning told him, you know, sorry, you're not going to make it. And he said the next doctor he went to, he wrote a letter and it explained who he was as a person. He said, hi, my name's so-and-so, I'm an actor, I love, you know, charity, I love, he talked about himself, and he handed it to her and said, don't treat me as a diagnosis, treat me as a person. And she came out with tears in her eyes, and that's when she said, we can't do anything for you here. And they were in New York City. She goes, but there is a research project going on down in Houston that is dealing with stem cell, and that's what actually saved his life.
Sure.
So yes, you need the compassion, love, treated as a human being. A patient also needs, you say, 24/7 access.
Absolutely. Doctors now are extremely busy. They are immersed in a lot of bureaucratic work to comply with insurance and with government rules and with protection against litigation. Yeah. So they have little time to sit down with patients.
At their scariest time in their life for a patient.
Absolutely.
Yeah.
And one of the most important things when we treat cancer patients is to give them hope and to give them a reason why they should fight. Yeah. Because perseverance is a key to success. This is a longer journey. I might fail as a doctor in the first trial, second trial, third trial, but I might win the fourth battle. And it makes a big difference. Perseverance is a key. Yeah. Hope is a key. When you push patients out of hope, patients go in despair and they may stop therapy.
They give up.
Stopping therapy meaning death. Yeah,
yeah. You say the U.S. has world-class medicine, and we know that part, but insurance interferes at every level. And you mentioned litigation, the whole, but all that stuff gets in the way, and that's why we need that healthcare reform. But how do we get some of that stuff to the side as opposed to getting in between a patient and a doctor?
Yeah, well, I think the challenge number one is to liberate the doctor from the tyranny of insurance. And in my opinion, insurance people didn't go to medical school. It's the doctor who went to medical school. And insurance has no right to dictate directly or indirectly how to treat patients. That's the privilege of the doctor. And it's very, very important to liberate the doctor from that tyranny. Otherwise, insurance becomes a guarantee, indeed an insurance, that the patient will never receive the best treatment.
Yeah, we hear this term boutique medicine a lot lately, which kind of goes into this next part here. Standard therapy is a misconception in cancer. Is that because there's no blanket one-size-fits-all treatment for someone?
Sure, and you know, standard therapy is good therapy. but it doesn't necessarily mean the best therapy. The difference between good and the best in cancer is the difference between life and death. Many times, standard therapy lags behind the most up-to-date modern treatment. The patient has the right to receive the best treatment. Doctors in America are afraid to deviate from standard treatment because they become exposed to the risk of litigation. Unfortunately, instead of the doctor worrying about the best care to give to the patient, now doctors worry about their protection against litigation, and they may know that the treatment that they are giving is not the best, but they want to protect themselves first. This is very dangerous. We also need to liberate the doctor from the unnecessary litigation.
And have them focus on doing medicine.
On doing what is best,
for the patient.
Not what is good, what is best. Because in cancer, it's different from other diseases. As I said, the difference between the most up-to-date modern treatment and what is considered standard therapy could mean death versus life.
Yeah, and you say the right to live is the most important right of all.
Absolutely.
Because we look at healthcare, sometimes, you know, we have to struggle with, is it a privilege or is it a right?
It is the most fundamental and the most sacred right. We need to modify and amend the United Nations Charter of Human Rights, because the most important human right, in my opinion, is the right to health care, the right to live. When you are born, you need a government to protect you against disease.
You don't have a pursuit of happiness unless you can live.
And when you are sick, you have the right to receive not any treatment, the best treatment. In America, the debate is on access to treatment. I think, in my opinion, the debate should be on the quality of care and quality of treatment. If you don't have the right to live, the other rights in the UN Charter are meaningless. You have to live first to exercise the right to freedom, the right to assemble, the right to choose your own religion.
Nothing else matters.
These rights fade in comparison to the right to live, the right to health care.
Who is this book for?
This book is addressed to the cancer patient, their families, and also to the doctors who treat them.
All right. Dr. Philip Salem's book, Defeating Cancer, Knowledge Alone is Not Enough, is available now. And for more information about Dr. Salem, log on to greatdayhouston.com and we will connect you. Thank you so much.
Thank you.